Dr. Laura Hanson today with Connect My Brain. And we've known each other for a very long time. And
Yeah.
she's got quite the fascinating journey that she's gone through with this. And she has a very unique way of doing things with a very large focus on children and not just with neurofeedback, but doing a lot of different things. And very totally respect what she's doing. She's getting out there with podcasts and courses and all kinds of things. So it's really
Oh, and
amazing to
my app
see. And
launched.
an app.
Yeah.
Oh, wow. Okay, that's cool. Awesome.
Yeah.
Well, Laura, why don't you tell us a little bit about your journey? Like what brought you into neurofeedback? What's keeping you there and why are you so passionate about it?
Oh, I do. I absolutely love neurofeedback. I'd really like to go on a sabbatical for about 6 months, like with the most amazing trainers in the world and just pick their brains. Um, so I started off as a traditional chiropractor, and the very first thing that opened up a window and made me look in was I just had so many kids come to my office. And then I don't really feel like we get a very detailed education in pediatrics. So that launched me to go into a program where I actually became a diplomate after about a 3-year program where I was now focusing on children. And I was like, wow, this is just so fascinating how the brain and the nervous system gets wired up. And then they asked me to teach in the program and not just teach, but teach neurology. Oh, sure, no problem. And so, of course, I want to be able to do my very best. So that took me down a path to do other types of credentialing. And one of the things that also really changed my view was becoming a neurodevelopmental therapist because I saw the progression of neurological birth and what it meant before pregnancy, during the delivery. And so I'm doing my thing, but I love primitive reflexes, but one of the ones with Moro, which is the AKA startle reflex, trying to show parents, oh, did you see your kid? They just had a startle. And they'd look at me like, yeah, I'm not quite sure. So I wanted to quantify it. And there is an amazing man in chiropractic. His name is Dr. Richard Barwell. And he worked with thought technology to create a system that is called the Neuroinfinity. And it runs a stress response test. And it's got brain waves and heart rate variability, skin conduction, temperature, respiration, and muscle tone. Well, Moro has three things that it activates in the neurology: arousal, CO2O2 reflex, and the sympathetic nervous system. So I could quantify a chronic stress pattern and equate that back to a child still having a Moro reflex and why we had to break the arousal pattern. And of course, going on deep into the journey of becoming board certified in neurofeedback, that's one of the very first things that they taught you, that you have to break the arousal pattern. So all these pieces were coming together. And it was started off in a very simple unit. And of course, I just kept mastering that one. And then we had our own family personal experience when my daughter, 8 years ago, suffered a severe traumatic brain injury. And she had to relearn how to walk, talk, eat, toilet, dress herself. It was very serious. Part of her rehab was neurofeedback. And I took her to another one of my mentors, Dr. Cantor, who had this amazing system. And now I was getting introduced into 19 channel and these in-depth reports. And I was like, oh yeah, this is definitely right up my alley. So then that's when I started going down these paths of becoming board certified in neurofeedback. And then last year actually earned my diplomate in reading QEEG. And, understanding how the brain becomes wired and that there's patterns. And so you can work on the body. We have an incredible movement program here. We're very deep into functional nutrition, but you can't leave out the brain. So my three-tier approach is mechanical, chemical, brain. And so every little kiddo that comes in here, they're going to have a brain map. And then we'll do our other pieces to our assessment. But neurofeedback is part of the equation. And there's caveats. For example, if you had a child that was very low functioning and you really couldn't keep them in the chair, it's not time yet to bring neurofeedback into the equation. But once that child gets into their body, it's an amazing way to help them catch up. So when you look at the brain and you look at how we do get wired, you come into this world, you're fully formed, but you're not fully functioning. You're in your brainstem. So when we're looking at children on those maps, you're looking at the development from the ground up. And so you get to influence the direction, the way, for them to become all that they are meant to be by teaching them how to self-regulate. And neurofeedback's a great tool.
So for the layperson out there, primitive reflexes, moral response, all these things, no idea, right?
Okay,
Could you just maybe put that in layman's terms a little bit?
sure. So before you ever get here, before sensory motor, the nervous system is being turned on, regulated, directed by reflexes. So the best way that I can explain this is the first reflex system is called the withdrawal reflex. And this is very, very early in pregnancy. In fact, the nervous system first learns how to defend themselves. So when you think about what is in the womb, it's the baby and amniotic fluid. So it's ripples and vibration. That's it. It's light touch. Light touch is a pathway. So that reflex is priming the nervous system on how to pay attention to a very, very light touch that could possibly be a threat. And then reflexes grow up. So that particular withdrawal reflex, it grows up as an adult. If you stepped on something, you recoil right off. If you were cooking, you'd skim your arm on a hot pot. We don't sit there and go, wow, my flesh is burning. We pull our arm away without even thinking about it. So all of this goes on. All of this goes on before that baby even gets here. And we go from the withdrawal reflexes to the primitive reflexes. Then when you're born, it's the postural reflexes. So I mentioned Moro, that comes on at 9 weeks in pregnancy. And it creates the function of arousal, CO2, O2 reflex, and the sympathetic nervous system. Arousal is, will that newborn baby wake up every 2.5 to 3 hours to feed? Glucose can only last so long in a baby brain. So literally, this is a mechanism that wakes the baby up, and the baby startles a little bit and cries, and we go and feed the baby. CO2, O2 reflex, that's a little bit more serious, because what it's about is that if we don't register that there's too much CO2 in the body, the Moro reflex, which what it does is it literally creates a startle with a big inhalation. You take air in. So if that baby had too much CO2 in their body and they didn't register, wake up, become aroused, take a breath, the CO2 would climb, they drift off into a deep sleep. And that's what SIDS is, sudden infant death syndrome. That baby is under aroused and it's not getting the message. And then the third thing is the sympathetic nervous system, which is fight or flight. And I think most people understand that term. And then after all of those reflexes go through their patterns and the baby comes into the world, that's when the postural reflex system comes on board. And we notice it because the first couple of days we all go, oh, wow, look, he's lifting his head. She's lifting her head. The body is literally beginning to interact in gravity. And think about how long it takes us to walk as baby human. It takes 12 months. So there has to be this hardwired system that is helping us adapt into our environment and to have some tools before we even get here that can make sure that we move forward. So that's really what the reflex system is all about.
Okay, so let's take this into a real world example. So let's say there's I don't know, a 10-year-old boy that's having problems at school. He has, symptoms of ADHD, might be on medication, might not be, but everybody's concerned. What do you do in that case? What do you do to help them?
Well, I've got lots of those running around my office right now. So again, the first thing that we do is we're going to do a brain map. And one of the reports that I look at is called an S-Loretta summary. And I like it because it has lots of color on it. Now, the goal of these reports is not to have just gray heads, meaning no color on there. But when you start seeing patterns of over arousal, like we were talking about, then they're like covered in red. And I call them the red hot chili pepper brain, meaning that their little brains are just on all the time. And what we have to remember, attention is a developmental sequence. There are certain things that you go through to learn how to pay attention. So you're going to find things just even in the intake form that start to tell you, hey, I missed some steps. And again, that's what wired up this brain. So a lot of the times you've got children that are carrying high levels of angst and worry that could be mistaken for, I can't pay attention. You can also have a lot of issues with visual integration and alpha brain waves, which is that 8 to 12 hertz, and it should dominate in the back of the brain. And when it dominates in the front of the brain, it's very difficult to pay attention. And when you find these patterns, what I try to help parents understand, this is a feedback mechanism. Just like if your belly is telling you you're hungry and you go get something to eat, your brain's doing the same thing. If these patterns are there and they're dysregulating how this child is, or it's really interfering with their ability to sit calmly and to focus because the brain's just saying, go, 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 go. It's very difficult to calm yourself and be able to then do what it is that people are expecting you to do. And that part too, I try to explain to parents is that so many times these kids are put into behavior problems and nobody has looked at them developmentally. Now, this isn't going to be every ADHD kid, but for example, after we do the brain map, the other pieces that we do in our office is we're going to go do a mechanical developmental assessment. And what I'd like to do is highlight this concept of lateralization, which also is demonstrated on a brain map. And it typically is going to be thought of as dyslexia, meaning a disorganized brain. And so early on, even with the reflexes, when there's another reflex, early on, womb, birth, first few months of life, asymmetrical tonic neck reflex. Break down the words, asymmetrical. So one side of the brain's doing something, the other side of the brain's doing something else. And literally, it drives the body for that arm and leg on the same side to still be coordinated, literally cutting us right down the middle. What's going on during this time is all of the specialty centers in the brain are being laid down. So what's that? So the right side of the brain is the big picture. The left side of the brain is the detail. The right side of the brain is the big muscles. The left side of the brain is like the muscles that you use for handwriting. The right side of the brain is the need to talk. The left side of the brain is work of talk. And everything about what we can do. There's a specialty center in the brain, but that has to be laid down. And then around the first 4 years of life, it's growing, it's maturing, things are happening. And then it's going to start to talk to each other. And if a child does not crawl, that gets really interrupted. The pattern. So we have unhealthy patterns, but we also have very healthy patterns. And when a child gets on their hands and knees, not a bottom shuffler, but their hands and knees, and use the opposite arm and leg, they're literally pulling this information from side to side and training it to know how to coordinate and do what it needs to do in function. And we have a lot of people that have told me over the years that their pediatrician told them, no big deal if you crawl or not. It's a very big deal. And so when we do the movement piece, we're looking at those things. We're looking at the ability to use the bottom, top and bottom, or looking at the body to, can you synchronize upper body, lower body, left and right, because that should be very fluid. And every child, based on their age, has milestones that they should be able to do. A 10-year-old should absolutely be able to do all of those patterns with ease. And what you find lots of times, they can't. So if my body can't function in the world, how do I sit still and do something? Because my body's giving me a different message. So we're going to look at those pieces as well. And it's so beautiful how the map of the brain and the body really come together. And the third part we do is we get really into the neurology and we look at auditory processing, because when you come into this world, you hear low frequency sounds. You have to acquire middle and high over the first 3 years of life. Okay, we got to see if that got organized. We have to see how well your eyeballs work. And we're not talking about visual acuity. Your eyeballs have 6 muscles wrapped around each eyeball, and they move. Your eyeballs are the only piece of neurology that's outside of your skull. But the visual cortex is all the way back here. So everything that you see has to travel all the way through. So this is your perception. This is how you see yourself in the world and how the world is functioning around you. And we put all of that information together. And when we look at the maps, one of our reports has like symptoms on it. And I'll ask the parent, look at the symptoms, tell me where these match your child. You don't have to have all of them, but which ones of these match your child. That way you can see, here's the symptom, and this is what's going on in the brain. So this is something that's been practiced. It's now a pattern in their brain, and it's come to the point that now people can see it because he's 10. Sometimes they're seeing it when they're 5 and 6. I'm now more than ever, I'm hearing it about toddlers. So you can see these things, but it's always been a very common occurrence that many of these things are not seen until the child gets into school. And if the child is medicated, it's okay, because neurofeedback actually makes medication work better. And so when you're exercising the brain and teaching it the correct power and rhythm and organization, you may be able to go back to the person that prescribed the med and say, you know, we're seeing some very positive changes. Could we go ahead and start to tailor that back? That's not my job, but that's the kind of conversations that I have with parents, because lots of people are realizing that they would rather figure out what's really going on. Can we resolve it and allow this child to have a childhood?
Okay, so that sounds like a lot. Now, I think you have a very in-depth intake process where
Oh,
you do
yes.
a thorough assessment, and that's where you go through all of these things and find out, right? And then you put together a plan for that particular child. Now,
Yep.
not just for children though, right? You also help
That's right.
adults,
No, we have
all
adults
different
too.
things, anxiety,
Yep.
all that kind of stuff, right?
PTSD, depression. Yep.
Yeah. What would you say is the success rate when somebody comes to see you, and they get, they have a certain result they're looking for, and at the end, what would you say the percentage is? Like, most people receive what they're looking for?
Oh, yes. And, this is always a hard question because we are so result driven that I'm going to pick up whatever rock I've got to look under to try to figure out what am I missing? What can we bring different to this equation? And that's just always been my style. So I hope it doesn't sound too egotistical, but it's a very high success rate, especially if people do the steps that we tell them to do. If you shortchange it, no, I can tell you right
Okay.
now, it becomes chaos.
So neurofeedback on its own can still make profound changes, but you're saying if they do these other steps as well, then
Well, and I think like my adults don't necessarily go through my movement program. But what
right.
I did with my adults is I actually created what I call the Connect Journal, because the more that you can practice this, that you're learning with neurofeedback, the more that you can really understand the engagement process and make this part of a daily routine. 10, 15 minutes, meaning like biofeedback, you learn how to breathe correctly. Practice breathing 2 to 3 minutes a day. Quiet your mind. Like with neurofeedback, you have filters, visual and auditory. The picture is bright. We teach our adults, we teach our kids too, they figure it out. But when the picture is bright, you're in the right place. So, of course, adults want to try to muscle it a little bit. What do I have to do to make the picture bright? And I have to tell them, do nothing. Allow your subconscious mind to figure it out. And then, if they start to really connect with that feeling inside, wow, this is what it feels like to have my brain in a state of no anxiety, free
No
of
doubt.
fear,
Yeah.
right? And then you practice that. So we're really about trying to teach strategies, because I think it's only going to be a great practice if I can teach you and then you can take it out of here and you can put it into your daily life.
Okay. Okay. So give me a real memorable success story that you can think of.
Okay. Um, I'm going to give you an adult and a child. Okay. So I had the absolute honor of working with a young woman, a mom, and she had had a brain tumor. And she literally had a metal plate on the left-hand side of her head. And so that in and of itself is a challenge to learn how to do mapping and training and avoid metal plates. But she had anxiety. And it was to the point that she couldn't even drive herself here. And even walking in, she would be shaking. And even as I'm saying this, there's another one that came in January in a similar state, but no brain tumor. And these women are now living a full life and they're not anxious, which how much better is it for the one that had the brain tumor? Because she's got to go back every 6 months and have a brain scan to make sure that nothing is growing back. I can only imagine the stress that that would put anybody under. And is her body going to be able to heal innately better if you break that stress pattern? And then to me, the real mark of success with somebody is she's constantly referring people here to the office. And they all come in and they say her name. And to me, that's one of the greatest gifts that you could ever give anyone, is that you have done such an amazing service to somebody that they would go and tell somebody else.
Right.
And that's the same kind of thing even with a child. And one of the things that people will ask you is, do you have to come back for maintenance? Do you have to come back for boosters? And so one of the things that's very common that you see with children is when they have any kind of growth spurt, that cellular memory has a tendency to surface. So this other little success is one little boy who came in, he thought he was a complete know-it-all. And I had to break that in order for him to hear me. on anything that he had to work on. So that was a challenge. But over time, he began to be able to see himself rather than thinking he had to be a certain way, because that too would just generate so much stress. Well, he had to come back for a little booster. But when he did, and he's colorblind. And so we got to see the impact of like how that would impact the brain map. But what we found is if he wore green glasses, it changed the pattern of the brain so quickly. And so that was like insight and experience. And again, and it's another family that's constantly referring patients here. And so, I don't do a lot of advertising. It is typically more word of mouth. I know I'm going to dive into some of that, but it's always been a word of mouth kind of practice. And I think that's just one of the greatest honors, is that somebody feels like I serve them that well that they would tell somebody else about me.
So you do chiropractic as well?
Yes, the
Okay.
body's a
So
pattern too.
yeah. So if somebody is dealing with back pain, they can come and see you. If somebody's dealing with anxiety, they can come and see you. Like, is that how you operate, or is it more, do you have that full assessment for each person and depending on what they need? Like, how does?
Well, long time ago, I used to be quite rigid in the idea that no, we're going to have this full enchilada. But now, over probably, I guess really over the last 3 years, there's been, I think many people in business have learned to be a little bit more flexible. And so I've done many different kinds of assessments. And I do
Okay.
have people that just come in here for chiropractic, but I do a lot of teaching. And one of the things that I try to get other chiropractors to understand is pain is a pattern too. And if that is chronic, you are changing the real estate in the brain. And every year that you are in chronic pain, you are losing 2.3 cubic centimeters of gray matter. That's where you process. So a lot of people will say, oh, I've been to a chiropractor, it didn't do any good. I still have all this pain. Did you put your brain into the process? If we don't change what the brain knows, it's a feedback mechanism. The chances of you continuing with pain are very high. So
Yeah, because there's
if you're
pain
going to,
from injury and that kind of thing, but there's
oh,
also
oh yeah,
neural pain caused by what's going on in the brain. And I've recently been
yes,
speaking with a few providers, and they're telling me these amazing stories about people coming through neurofeedback and eliminating their chronic pain. It's amazing,
absolutely.
right?
Absolutely. Every function, every part of your physiology is up there. And you could get any kind of symptom, but if you don't include the brain in the process, you're missing a big part.
Yeah. Well, I tell you, I mean, this has been an education for me, and I know something about this. So thank you. And I've known you forever. It's funny though, we haven't got into some of these deeper discussions, right?
No, we haven't.
That's yeah.
Yeah,
Okay. Well, thank you for that. I appreciate it.
sure.
So do you have any final thoughts? Anything that you would like people to understand about, yourself or your practice or how you're different or anything?
Well, we are definitely different. There's no question about that. So, taking that whole body approach, mechanical, chemical brain, we're going to look at your entire person. We do respect, sometimes people just want to dip their toe in, and that's okay too. But as you get to know us, then you start to ask more questions and we can go from there. But there are so many possibilities. And every day working with all these people, children, adults, it's been the greatest journey of my life. And the experience that I got with my daughter's brain injury really showed me. I mean, we're talking about a young lady, a young girl at that time who they did not expect to make it. There is this way that emergency people talk to each other. And it's always abbreviated so they can go fast. So this one's called the Glasgow Coma Scale, and it goes from 3 to 15. 15 is a mild traumatic brain injury. 3 means you're brain dead. When they picked up my daughter, she was an 8. By the time she got to the hospital, she was a 4. My daughter was dying. She had multiple brain bleeds. She was in a non-induced coma. I had to close my practice back then, and it was a 2.5 year journey. Amazing. But I'll tell you, when I walked back into this place in 2019, I knew that there had been no better mother that this could have been given to. And now I have the tools, the knowledge, the personal experience to be able to help others. And that is what I am most passionate about. I want people to live, not just get by. And there
How's your
is
daughter
so
doing?
much. My daughter's fantastic. I'm glad you wrapped that up for me. That's good because
You
people are probably
didn't
sitting there
finish the
going,
story.
"Well, how's your daughter?" My daughter went to college, and this is when you and I first met. And she went to UGA, and I lived up there by her so that I could help. But she graduated magna cum laude from the University of Georgia. She's completely independent. She's a beautiful, beautiful woman. Even her trachea, we found ways to smooth that out. That was amazing. So she is doing great. She is full of life. It is really amazing, but it
I'm
wasn't
sure the
an
doctors had a great deal to do with saving her life and all of that. But how much did your methods and the things you did for her, do you think that was a big part of her being able to recover, or was it more?
Absolutely. I'm going to say
Yeah.
probably they took care of the acute part. We took care of the rest of it. In fact, I can remember one time I had to call the neurosurgeon's office and ask for a script for a particular therapy. And I remember his PA asking me, she goes, "How do you know to do all of this?" And I go, "How do you not know? You're a neurosurgeon's PA. The world is wide open with new things. And I'm going to get my daughter back. I'm going to get everything rewired." And I go, and I'm not stopping until we're there.
No, good
So
for you.
I don't really think they know. And they live in very, very finite places. Now, I think there's a lot of great functional MDs out there and all different kinds of different specialties. But we have got to get out of this mentality that if my insurance doesn't cover it, I'm not going to do it. Insurance is not, I mean, that's just a whole nother rabbit hole, but that is not what should be managing the decisions and the directions. If I hadn't done what I did, not only with myself, but some great, great doctors like me, Carly would not be where she is right now. And she is
Wow, it's
amazing.
quite the story, hey? I
It
remember
is.
when we first met and you were telling me those stories about her. It was pretty awesome just to know.
And,
And
and you
hard,
know,
because you were still
I gotta
going
be
through
honest
it,
with you.
you know?
Yeah, but this is probably one of the first times I've really talked about it.
Is
Because
that right?
yeah, I don't really bring up my personal life too much. I really don't. But
Well,
you
I'm
know,
honored that you decided to share it here. Thank you.
yeah, well, I've known you for a long time and you did. You came right in at the thick of that.
Yeah, yeah, I remember. Well, okay, so whether it's a parent of a child or if you're an adult and you're dealing with anxiety, stress, trauma, PTSD, whatever it happens to be, I know that they can contact you and you're totally willing to talk to them over the phone before they make any commitment or anything like that. So
Yes,
your
absolutely.
information will be linked and
Okay.
to your profile on All About Neurofeedback, and you'll be able to contact Laura there. And even if you need to travel a bit to get to her, I really encourage you because the depth that she goes into is rare. It really is. Um, yeah, you're a gift. Thank you.
Oh, thank you. That's so nice.